There we go. Awesome. So welcome to the April Inland SoCal Housing Collective meeting. Um, we have a full meeting planned today. We have two speakers. Our first speaker is Jasmine Hutchinson here from Loma Linda University, who's going to share a little bit about their community health needs assessment that they recently completed and launched. I think it was in March. And so I've been trying to get at Jasmine. I'm like, we got to find a time for you to share your results because I think it's so important, especially from our health institutions in the area, to share what they've learned, to provide that context for us, because we just value and we just see the correlation between health and housing. So, Jasmine, I gave you presenter rights, so you should be able to share. Um, and feel free to start. Thanks.
Perfect. Thank you. It's an honor to be here today. And my name is Jasmine Hutchinson. I'm the Community Benefit Director for Loma Linda University Health. And, over the last, I feel like maybe 6 months to a year, I feel like there's been a stronger connection with Melanie, with the Inland SoCal Housing Collective, and some of the work and collaboration opportunities. So uh, we, I'll just start it off with, this is our CHNA has been really developed in partnership with so many different organizations across the Inland Empire. So our geographic area is the Inland Empire. The data is a little bit older at this point, but I still think there's a lot of really valuable stuff in there. But I'll get into that in a moment. So the CHNA, it focuses, as I said, on the entire Inland Empire region and covers all three licensed hospitals that we have at Loma Linda. Um, but it's really meant to be a document that is for our community as well, and for all of you, and for you to be able to leverage that in your work as well. How many of you have seen our CHNA? Nope. Okay, wonderful. That's perfect. I'm glad I'm here then. I will go ahead towards the end of this. After I stop sharing screen, I'll actually pop in the chat the actual CHNA so you all have access to it. This was the first, so we do our CHNAs once every 3 years. This is part of our regulatory requirements for all nonprofit hospital systems to do this. But I will say that the regulatory piece of it is honestly one of the last reasons why we do this. It's important, but it's really about understanding trends and how things are changing in our community and their needs and their strengths, and what we can do to kind of, leverage some of the assets that we have. So we definitely don't see it primarily as a regulatory report. We see it as a continued conversation and a way to more deeply understand the region that we're serving. This was the first year, and that in our CHNA, we actually completely reorganized everything around the vital conditions framework. And my understanding is you all are pretty familiar with the vital conditions framework. Is that right? Or is this a new? Okay. Um, yeah, I know Melody's been leading out in that area, so I expect so. Um, so the vital we wove the vital conditions framework into the survey design itself, into the community conversation guides, the key informant guides, how we organize things, how we analyze the data, the entire overall presentation of it. So it is, I would say, through and through vital conditions aligned. And that for us, what was so interesting, I think, this year is that allowed us to really understand areas that we'd only just touched on previous cycles. So we would ask maybe a couple housing questions or maybe one question around, nature and thriving natural world, but like didn't get into it as deeply as we were able to this round with this focus. So we are, oh shoot, sorry. I didn't realize this is animated, but here we go. Um, we are all part of a rising movement to thrive together across the Inland Empire. And so This is, a map of all the different locations and regions across the country that have really embraced the vital conditions. And we were able to learn from some of them because we had these broader connections. So I actually used, survey questions on belonging that came out of Wisconsin. I've shared our CHNA survey with folks in Contra Costa County in California and others. And so it's become a bit of a sharing platform too of the best resources out there, which has been really cool because that helps make sure that, we're all aligned with kind of best practices and can leverage um, kind of shared language and across the kind of broader network nationally. Oops, sorry. Okay. So the CHNA, as I mentioned earlier, was a deeply collaborative effort. We partnered with the School of Public Health for the second time at Loma Linda. This is a win-win that brought rigorous qualitative data collection, analysis, and reporting. And throughout this effort, we were also able to provide real-world public health experience to the School of Public Health students. In addition, we were proud to work with more than 30 partner organizations across the IE to ensure that diverse perspectives by geography, population, and ethnicity. The 5 organizations listed in the top row helped us to collect more than 800 surveys from across our region. And you know, so let's see. We also partnered for the first time with our own emergency departments, adults emergency department, children's, and advanced urgent care to distribute surveys to people in the waiting room. And we had never done that before, but I think we had been wondering how well um, whether the needs that we were seeing outside of our health system in the broader community also reflected who was coming into our health system and the needs of our emergency room patients. And what we found was it was pretty much a direct match with almost very few exceptions. So very much we are serving the broader community. And that also helped us to get buy-in from not just buy-in, but I would say or an additional sense of urgency from our leadership within the healthcare system of how critical, some of these broader social determinants of health and vital conditions are for our patient population, because we were asking questions they had never seen before in our patient populations. So just an interesting, different thing we did this year. We heard from a total of 1,300 community voices across the IE. This included 1,100 community surveys, 21 community conversations for 150 different people. And we really, we had quite a number of those in Spanish, and the same thing with the survey respondents as well. We also interviewed 16 key informants across so many different sectors and from public health, education, advocacy, faith, nonprofits, et cetera. The regulatory requirements for CHNAs do require us to focus on the most vulnerable populations, which is who we are trying to focus on. So this is kind of the composition of who we reached out to and heard back from. So you can see there's definitely, pretty, I would say, common spread for age and things like that. We had a little bit of an overrepresentation of Hispanic or Latino populations in the survey, a little bit higher on female, and then on the lower income of the lower spectrum of the household incomes. And you can see a map of there as well. When we're thinking about, health, the forces impacting health equity in our region, we were really wanted to pay closer attention to the broader landscape. So, including the fact that we have one of the fastest growing metropolitan areas in the United States, which I'm sure you all are aware of in housing. We have a significant shortage of healthcare professionals in our region. More than 2 million people are relying on Medi-Cal for essential healthcare, and that has been shifting, right? in terms of who gets access and changes in federal administration laws. We also had pulled, the statistic we came across was 110,000 households are at risk of losing their housing in the near future. We've seen a huge number of hospital and labor and delivery units that have closed across California since 2014. And even more recently, there is one in the Hemet region that recently closed that as well since publishing this. So of course, like you all know that the warehouses have taken up more and more space in the IE, reaching 1 billion square feet. So one of the questions that we did ask in the actual survey for the first time was around thriving, struggling, and suffering. So we used the Cantrell's Cantrell's ladder measure of figuring that out. And our data really closely tracks with the research that has come out of the University of California Riverside, UCR, is it Community Solutions? Justine Ross's group and research. So yeah, this tracks pretty closely with what they also found in their research. Because we had these really rich conversations with folks in the community conversations portion, we tried to understand, how these different vital conditions were impacting people. So these vital conditions are pretty closely aligned with the colors of the vital conditions. So you can see, I'll just read you a couple, but the cost is very high and you work, but it's not enough. So it's either you don't pay rent or you don't eat. I'll read you another. I've lost 3 people in the last 4 months, 2 to overdose and 1 to suicide. That's just in the past couple of months. Overdoses are a big issue out here. I had to live elsewhere for work because I couldn't find jobs that were meaningful to me. And when I did, they either didn't pay well or they didn't offer health insurance. One of the problems I have here is there's not even a sidewalk. So when it rains, it pours. The kids walk to the school right here, but they have to go around like this. Sometimes they even have to walk in front of cars to get there. Wildfires become a focus when they're actively burning, but as the climate gets more extreme, more areas are at risk. Air quality is directly tied to extreme heat. Our worst air days are also our hottest. It all stacks together, making things worse for everyone. So I'm going to walk through some of the kind of high-level data of what we saw from both our surveys. I did pull out some of the little bit more meat around the community conversations and key informant interviews and added it to some of the sections I thought you guys would be most interested in. But what we heard was that about a quarter of folks have somebody living in their household with either a physical or mental disability. A pretty sizable proportion of folks either often or sometimes worry that food would run out before they have money to buy more. 21% of the folks that we surveyed lack health insurance, and 15% reported someone in their household was unable to access needed physical or mental health care. 47% folk reported someone in their household is living with a chronic disease. And of those who said that they did have somebody living with a chronic disease, the number one type of chronic disease was type 1 or 2 diabetes, followed by asthma, and then obesity and mental health. So interestingly, in our emergency rooms, we had this is one of the only differences we saw was that asthma was number 1, followed by type 1 and type 2, but otherwise everything else trended pretty closely. We asked people about how they felt about their education, and we heard that 63% would like to go back to school for additional training, certification, or degrees. And over 45% have paused or stopped their education to financially provide for their families. Within the meaningful work and wealth category, and I know Jay's here, we have a lot of folks, I'm sure, working on this category pretty intensely. We did hear that, so a lot of we kind of put together this graph on the left that shows who we heard from with the surveys. 75% say that the work they do is meaningful. 31% of participants do not have the needed childcare to take care of their children while at work. 52% do not have enough savings to cover an unexpected expense of $500. You can imagine how much uh, that can destabilize somebody if one of those unexpected events happen. And 32% of participants work jobs that do not pay enough to cover basic bills. So obviously we have an affordability crisis, which I know you all are aware of. I want to quickly pause and just say this data was primarily gathered during I want to say December to March period of last year, and we know a lot has changed since then, and not necessarily for the better. So it's quite possible that, this is potentially an undercount of what it might look like if we were to do the surveys and stuff again today. From what we are hearing anecdotally in the community. I'm not going to read off all of this, but we did kind of pull some of the key themes, both from key informants and community conversations. And I did share with Melanie, I understand you're all working on a strategic planning exercise. So I shared some of the more raw data summaries of the different community conversations that can kind of pull at some of the richness of what we were hearing. But, I think the distance was a big issue, right, between work and where people are living. There was, the expansion of financial literacy and access to banking services in underserved communities was really important. Addressing some of the wage gaps. We heard, from community conversations, it was more, wanting stable, well-paying jobs and different types of training programs that can help people move up in terms of economic mobility. And then, the just sort of general pressure of inflation and rising costs and benefit cliffs came up as well too. Humane housing, I want to make sure I don't use up all of your time, Melanie. I'm going to move a little bit faster through here. So only 78% of people reported having a stable, permanent place to live. We had about 8% of the folks that we had surveyed are staying in short-term accommodation, including a shelter, couch surfing in a car, or sleeping outside. 15% actively fear losing their housing. And then within 35% reported some kind of health and safety concern in their housing. So commonly pests or lack of air conditioning or heat, which lack of air conditioning, I think, in this region in the summer is pretty extreme. And then we asked a couple questions about barriers to home ownership as well. So again, with the key informants, we had, a request for kind of more affordable housing, family-friendly units and supportive housing, streamlined zoning and permitting to speed it up, anti-displacement protections, housing rehabilitation programs as well. And then community conversations, we're aligned with that as well. Landlord accountability, affordable housing, more transitional housing, and opportunities to repurpose vacant or abandoned properties for community use. Transportation, we saw that a good number of folks, actually, it was about 31% of folks live more than 30 minutes from work. And then we asked a couple more questions about grocery stores and schools. 20% said they were unable to reach a needed location due to lack of access to transportation during the past year, and 73% had never used public transportation in the past year. So, thriving natural world. This one actually honestly surprised me a little bit, but only about 50% say they spend time enjoying nature. Um, 50% say they spend time enjoying nature rarely or only several times per year. 61% feels that their community needs additional recreation parks and green spaces. About 1 1/3 say that the weather affects their ability to work or earn income. And so when we think about what that looks like for folks as weather is getting more extreme, and you can have, a bad smoke event, right, that can last a week, or a terrible storm, or something that, and people are already kind of living on the edge of financially when it comes to thinking back to that $500 question earlier. So asthma is the second highest chronic health condition in participant households, and you probably already know too, but we have the worst grades by the American Lung Association for air quality when it comes to ozone specifically, for both Riverside and San Bernardino counties. Belonging and civic muscle. Only 57% of people feel they truly belong when interacting with people in their community. 28% said they've experienced discrimination. And a lot of folks responded that they go to either church or family members' houses or friends' homes when they're seeking kind of the sense of community and belonging. And all right, I'm gonna speed up because I want to make sure we have a couple minutes for any questions, but I did put in a little bit more around belonging and civic muscle. I can share this out with you, Melanie, and feel free to share it with the group as well. It's in our DNA, it's in our spirit, it's in our culture. There's not a challenge too big. Loma Linda is centering around 4 specific vital conditions that are very closely aligned with kind of our bread and butter and who we are. However, I will say that, it is our plan to make sure that we are working across all 7 vital conditions. And so, it's also important we recognize that the landscape is shifting. We want to remain relevant and responsive to our community. And I think we're starting to see some really interesting things come out of where networks meet other networks. So I know Melanie's been a big part of kind of the conversation around with the maternal health network, actually, a lot of folks bringing up the need for housing within that community, and sharing how challenging it is from a healthcare perspective, and also thinking about the generational effects and ACEs and all the different kinds of health challenges and lifelong challenges that come up when that particular vulnerable population doesn't have stable housing. So again, that's pregnant women, infants, and their families. And then so I think there's also opportunity for us to share a little bit more sometimes, specifically from the healthcare perspective, to help inform strategies. We have community health workers and others who are really helping to guide folks working in, who are unhoused or are experiencing challenges with their houses. I also often think about the flip side of it. There's all the good stuff we can do together, but there's also the how do we prevent the bad stuff from happening as well. And so I think medical debt is one of those that I think about a lot. And we have an opportunity in this region to improve housing stability by reducing medical debt. So I'm going to pause there. Any questions? I know I sped through some of that. Let's see.
I don't have questions, Jasmine, but that's really great data. Thank you for sharing it.
Yeah, thank you for listening.
My question there is around the priorities. I know that the four priorities, that includes humane housing as well as wealth building, which the
Yeah.
collective is deeply involved in too. I know what opportunities for our other partners that are here, are there for them to interact with those strategies and to like stay attuned to, how can they be on the lookout as to what Loma Linda is doing in terms of those conditions that they're operating in and the strategies that they're working on. Jasmine, do you have any way that our collective members can stay kind of like attuned to what strategies Loma Linda University is there like a newsletter or is there something that we could stay on top of how our humane housing folks or folks that are in this housing space can interact with Loma Linda? And maybe that's something I could follow up in the newsletter and stuff. If you don't have it right on hand to drop in the chat or anything like that, I could follow up with folks.
So I will say, I just popped in the chat. We
Awesome.
have kind of all of our, we're on a very rigorous cycle,
Yeah.
consistent cycle. So we have every year we publish our community benefit report plan, which really seeks to integrate a lot of the work that the hospital is doing, our Institute for Community Partnerships. This is an report. So you can check that out, and that might spark. Like I've seen some people
Okay.
go through it, and then it sparks. It's like, oh, you guys are working on
Yeah.
that. We're working on something really similar, right?
Oh,
And I can see some synergies there. The CHNA itself, I'm gonna pop in the chat as I promised. And then in addition, we have kind of built out like our 3-year community health implementation strategy. So, um, and you may see that may also spark some other ideas um, around, potential synergies.
mhm.
So,
Awesome.
yeah, I think that's
Sounds great.
probably a good, just if you see anything that looks like aligned with what you all are working on, or even I've shared this with other folks before, but I really think that the magic is all going to happen when networks meet each other because those are the
Mhm.
most intractable problems.
Mm,
Those are the most difficult to solve. And so the more we can kind of weave together
mm.
these different networks, I think that's where we're going to have the biggest chance of real breakthroughs.
Yeah.
One last thing, and I know you have another speaker. The Ripple Foundation are you guys familiar with the 20 goal? So the Ripple
Mhm.
Foundation, it's a national organization. They were one of the organizations that helped to create the Vital Conditions framework, along with the Robert Wood Johnson Foundation, and of course, so many other federal groups and
Yeah.
other folks who were focused on kind of honing in on it and adopting it years ago. And so they have kind of set a really ambitious goal. What would it look like if basically the whole nation jumped 20 points in that thriving metric?
Mm,
And so that one that I was showing you before, where I think we're at like 45% or so thriving,
mm,
it's
mm,
always kind of cycled between 40 and 60% historically. But what
mhm,
if we were able to have it jump 20 points in 10 years and stay there, or at least like continue to go up, right? Like sustain that type of gain. And so I think it's an exciting goal and really aligned with a lot of the work that we're already working on. And I think the Inland Empire is especially well positioned to kind of move forward with supporting that.
Agreed. Agreed. And I'm going to put a quick plug before we pivot to our next presenter for on April 28th, we have the IE Vital Conditions Network quarterly meeting. And so it is essentially a network of networks. And so it's an opportunity where the collective shows up as a collective for humane housing and also weaving our work a little bit into wealth building, belonging, transportation a little bit. And so it's an opportunity for you all to show up, to meet folks, to understand how this network of networks is really trying to move the needle forward cohesively across both regions, right? And across all different types of sectors. So it's like you ponied that up for me, to just kind of put that plug. So
Yeah, it's such an
mhm,
amazing focus on relationship building because the
mm,
trust has to be there and the collabor in order for those collaborations to deepen. But I will also say, like, if I think no matter what kind of organization you are, it's possible to like lean more deeply in almost every single direction of the vital
mm,
conditions framework. And so, like, I think this constant practice of asking ourselves, like, how can I, in my role, in my organization lean more deeply into belonging and civic muscle, for example, or thriving natural world? Like, what are the things that we can do to help support that? Is important. But I'll be quiet now. We can
Thank you,
move on.
Jasmine. I appreciate you coming and sharing the needs report. And I'll follow up and I'll include those in the links you provided in our um, newsletter follow-up. So
I'll
um,
send you the other piece too.
awesome. So we're
Okay.
going to pivot over to Lisa Watson. This next portion of our meeting is really meant to just get some feedback. So we have a very interactive session, and I'm gonna let Lisa Watson, who is our consultant for the strategic planning session, kind of take the lead, and I'm gonna run some polls in the background. But thank you, Lisa, for coming on, and we're interested in hearing what you have to say and share.
Thanks. I am going to start this from the beginning. Can everybody see the PowerPoint on the screen? Perfect. Okay. So just to let you guys know, I have a hard stop at 1:50, so I'm going to try to be as streamlined with the conversation as possible. I'm here to actually do a couple of things. One is to share with you kind of the 5 findings that I consider key findings from the partner survey. Many of you may have taken that partner survey. We issued it as a component of the strategic planning process that the collective is currently going through. We had a pretty good response rate with representation across all sectors that are engaged in the work. And so what I'm going to do today is I'm going to share with you what those 5 sort of key findings are, and then I'm going to ask for your reaction to those findings. It's part of the validation process that we're going through to make sure before we are sitting in a position of making decisions using the data that we're actually validating the data that we heard from all of you through the partnership process. So for context, the membership survey went out to folks who've been engaged with the collective in either the year 2024 or 2025. So even though you guys have been around for a long time, we chose to only engage folks who've had recent contact with the collective. The survey itself was out for about a month, so people had a month to take the survey. The survey took about 30 minutes to complete. Okay, so as I shared, I'm going to share the 5 key findings. The first area that we really wanted to understand is, what do people see the primary role of the collective? Where does the collective add the most value, and where should they continue to position themselves from a role perspective within the housing ecosystem? So as you can see on the screen, the strongest role that was identified was, I see the housing collective being a regional backbone that convenes partners, advances policy, and then helps to align action across the housing ecosystem. So if we had to kind of give you guys an identity, this would be your identity statement now and into the future. So with that, the question that I have for you guys, and Melanie is going to post this poll in the Zoom, is how well does this statement reflect the most important role going forward? So as you can see in the poll, you have a number of options. Strongly reflects, mostly reflects. You could have a mixed feeling about it. It partly reflects what we think we should be doing. mostly does not reflect or does not reflect at all what you believe the role of the collective should be. And if you don't know, please put not sure. We'd rather have you put not sure than just guess or do the Wheel of Fortune kind of roulette on which one of these you answer. I'm seeing a lot of strongly reflects and mostly reflects. And most of you have responded, 20 of you. We'll give it a few more seconds, and then I have an open-ended question I'm going to ask you about this. We've almost reached 100%. We're not going to because I'm not going to participate, Melanie. So I think we can go ahead and move on. Most folks said strongly reflects, with the second highest being mostly, and we have two people who said that it partly reflects what the collective should be doing. So with that, I'm going to ask those two people in particular to use their voice in this next question I'm going to pose to you. So the question that I have for the group, and anyone can take themselves off of mute and feel free to answer, is which part of this statement of this role feels most relevant to you and your organization's needs? And what, if any, part needs adjustment? Anyone have thoughts?
Hello.
Yes.
Yes, Maribel Nunez with IECLT. Um,
Maribel?
yes, I would say that I think Inland SoCal Housing Collective does do a lot of the good housing justice work, but there is also, even with our organization, that we lead efforts on other local housing policy work as well, intention or unintentionally, in regards to rentalization and inclusion housing and a bunch of other stuff. And so for us, we always are wanting to hear more what the collective's going to be doing and how can we be a part of it. So yeah, that's what I did answer that question about partly. And then also thinking through a little bit more about uh, in regards to how we work with electeds, in regards to fundraising for housing projects, too, that thinking through if that's something that the collective would like to do or not, just for our informational purposes. Um, but I know with our organization, we do that mostly on our own through state budget ask and a bunch of other stuff. So then for us, we want to think through a little bit more different partnerships, within this space or not other spaces. But yeah, that's kind of a little bit about kind of where we are now in this space. So just wanted to share.
Super helpful. Thank you, Maribel. Anyone else want to respond to the question on the screen before I move on to our next finding? Okay. So the second key finding was really around priorities and what the collective should focus on moving forward. So the sort of headline finding is that the future agenda should really focus on structural housing barriers and specifically investment alignment. And through the qualitative data that was collected through the survey, a lot of emphasis on that public investment alignment was elevated to importance. Okay. And I'm seeing poll 3 up. I think we actually need to post poll 2, Melanie. maybe it's just misnumbered because it looks like it's the same question. Okay, perfect. All right. So then the question that should have popped up on your poll is we really want to understand from you where your priorities are. So of those that are listed on the screen and included in the poll, please tell us what order you would like to see these efforts prioritized for the collective moving forward. I see the results coming in. There's strong support for the public investment and alignment. Also strong support for the housing production barriers and regional coordination, consistent with what the survey found. Like a horse race, regional coordination is now in the lead. Give folks a couple more seconds to answer. We've got 17 of you who have participated. Thank you, guys. Very good. We have 21 contributors so far. The results show that public investment and alignment slightly edges out regional coordination, but not by much, followed by housing barriers, zoning and land use, and then preservation, anti-displacement. Thank you, guys. Okay, I'm going to go ahead and move on. So the question that I have for general discussion is just, is there anything missing? So these are the ones that were rated in the survey as top 5. So you can see that there's a poll now. If you want to insert, if there's anything that you feel like is missing that should be left on the table for consideration, please respond to the poll now. We have a couple people who've answered. Thank you for that. I'm going to move on just for timing purposes. Okay, so the next area that we explored was around the pillar structure. So you guys have currently 4 pillars: public policy, housing solutions, regional involvement, and wealth building. And what the survey found was that there was still very strong support for public policy and housing solutions, that those really should remain your 2 anchor pillars to implement your work. There was strong support for regional involvement, but folks felt like it should sort of function as a cross-cutting strategy and not a standalone pillar. and that wealth building was still rated as highly important, but probably needed a little bit of rework to tighten the focus on financial access, readiness, and housing stability. So with that, the question that I have for you is, how well does this framing, the priorities that I just outlined as it relates to the pillar structure, how well does that reflect the right structure for your work? I see the votes coming in. Thank you, guys. – 75% of you guys say that you strongly agree with that. It was a pretty evident finding in the survey results, so thank you for that. I'm going to go ahead and move on to the next key finding, which is really around partner engagement. We wanted to understand really how well does the current structure work for engaging all of the partners that are required for you guys to do the collective impact work that you're working on. So what we found is that overarchingly, people are really were really positive about their experience, their member experience. What they did identify as opportunities for growth were folks were looking for clearer priorities, easier pathways for participation, stronger onboarding when they become a member of the collective, and more visible follow-through. So with that, we're going to now post a poll that's going to ask you what would most improve your engagement with the collective. And this is a single choice, so you have to tell us what would be most impactful for you to improve your experience as a member of the collective. Responses are kind of across the board, as people usually are. A lot of folks are indicating more tailored collaboration opportunities. Okay, with 19 of you guys having taken the poll, I'll go ahead and move on to our next finding. So the last finding really has to do with outcomes and the need and desire for the collective to develop more of an outcomes orientation. And so what the survey identified is that folks are most interested in seeing outcomes in these three areas. One, increase in affordable units produced or preserved. Two, in policy wins that are achieved through the support of the collective. And three, actually securing public funding or aligned funding to support your goals. So with that, we're going to ask you one more time, which one result would most clearly signal success over the next 2 to 3 years of those that we're suggesting based on survey results? So affordable units produced or preserved, policy wins, public funding secured or aligned, projects that are accelerated or unlocked, or stronger partner alignment and collaboration. The strongest outcome people are seeking based on current poll results are affordable units produced or preserved, followed by projects accelerated or unlocked. Well, thank you guys for that. Okay. Given that I'm already 6 minutes late to my next appointment, I've got to go, but I did want to round that up with you guys. You will be seeing me, I'm sure, at a future member meeting. Thank you guys so much for taking the survey. Thank you for your continued contribution during this meeting. Thanks, Miss Melanie. I'll connect with you later.
Thank you, Lisa. I appreciate it. So I appreciate you guys all staying on and taking this and survey. It's definitely helping us produce something that we think would be relevant, that would be strong and helpful for not just the collective, but for everyone here, right? And understanding where there's collaboration opportunities and where we can lean in together. So um, I wanted to take some time now to um, provide some updates on our general, uh, sorry, I made some, there we go. On our general pillar, on our other pillar meeting. So spending a few time to update on our policy as well as our wealth building, expansion of housing solutions. And then also to kind of put some quick just plugs as to what is happening. We have a busy month. A lot is happening this month, not only with the housing collective, but in the region. And so want to spend some time there. And so with that being said, in our Educate and Advocate for Public Policy pillar, this past month, we were able to meet and we evaluated three pieces of legislation to identify where we want to, how we want to prioritize it and how we wanted to advocate. The three that we evaluated was the bond, both bonds, and it was unanimous in terms of the collective, the pillar wanting to support and move that forward. The other two was SB 996 and SB 1092 or 1093. I'm getting mixed up, but I'll drop those in. Both 996 is um, basically a reclassification of mobile homes. So that someone who is purchasing a mobile home will have the opportunity to use as it being real property, they can use a loan, a homeownership loan, a 30-year loan, as opposed to a personal loan with higher interest rates. So it makes the purchase of a mobile home more feasible, and it really just classifies it as it should be, and as it's operated and often viewed. Um, our SB 1093 is a policy that is looking at first right of refusal for mobile home parks. And so this is something, since having a number of mobile home parks in our region and since being a piece of legislation that was originated in the IE, we wanted to definitely elevate this and support it. It's going to allow that the residents, it gives folks 90 days, those folks who live in the mobile home park to either refuse the right to purchase it as a community, and to pass it along to another buyer. And so it gives them a 90-day window to do so, to look at the plausibility of doing that. And so ultimately that will help preserve just generational wealth here. It'll help avoid displacement, which is kind of a trend that we're seeing with a lot of mobile home parks that are going up for sale and being bought by folks outside of the state or that aren't local to our region. In this next month's meeting, we will be looking at two other pieces of legislation, and we will be talking a little bit about prioritization. We will also spend a little bit of time of digging into some more of the strategic planning, but specific to our policy findings. And so I encourage you guys to join there and to provide feedback. We're really trying to do a very in-depth, extensive strategic planning process, and have multiple opportunities to include everyone's voice wherever they interact with the policy or wherever they interact with the collective. Um, Ayako or Jay, I don't know if you guys have if you can come off mute, and maybe we'll move on to expansion housing solutions pillar. We'll do that first. So go ahead, Ayako, if you could provide just quick update from our meeting.
Yes, everyone, Ayaka Utsumi here with Mary Erickson Community Housing. I also lead the expansion of Housing Solutions pillar. We meet the second Thursday of each month from 9 to 10 a.m. Second Thursday of the month, 9 to 10 a.m. If you're interested, please reach out to Melanie to get on the list. But before I go to this, Melanie, can you please give us a status on the mobile home becoming real property? Where is that in the life cycle? Is that about to go to vote? And it's I'm not clear like where we are. Is it still very, very nascent? Is it very mature, getting to the final stages? Where are we?
It's pretty mature, so it's made it out of hearing. I don't know if in PHS, I see Carson, but I know Ryan is leading that effort. But I know he had gone up in March to testify and provide testimony for it. It passed through with almost unanimous vote. And so it made out of appropriations. And so I will find the link and put it in here, but it has been moving with very little resistance.
Wow. Okay. So do we have a timeline?
I
Like some,
don't. I
oh,
don't right off the top of my head, but
okay.
I could find that and we'll make sure to include that in our pillar meeting in 2 weeks.
Uh, That's very significant.
Yeah.
Um, yeah,
Yeah,
good
if
to
I
know.
may
All
as
right. Well
well, I know
done.
it passed through the Senate Housing Committee. It's now awaiting, I believe, the Assembly Housing Committee. So Ryan, I know is standing firm on that, and we're looking forward to it, and very proud of Ryan and our team. But I'm gonna drop something in the chat as well for a link to that whole process.
Thank you, Carson.
Thank you. That's very helpful, very significant impact on making more affordable housing more accessible. So fantastic work there. Okay, back to the report. So I'm going to let Melanie talk about the mixer on Friday. This is our annual business networking in-person business networking event. It's our signature event where everyone, both counties are invited to just we have a kind of a limited formal program, but then we really want you all to just focus on networking. Look for someone from a city community development office, look for a lender, look for a developer, look for a support services provider, look for anyone who is in the philanthropy. Look for anyone who is in the affordable housing development world and make some good connections, because that's how we continue to work together. And as we all know, it does matter who you know, right? That is how deals still get done today. So come out, grow your network, and connect with your fellow Inland SoCal Housing Collective members. But Mel's going to tell us more about that. But for this year, our focus still is to look at the middle house. We're kind of carrying it over from last year because there's still a lot of things happening in this middle housing arena. So that's anything 2 units to maybe, depending on who you talk to, less than 20, less than 15 units, this kind of smaller infill type of housing. So we're looking at ways to, we're looking at other organizations like the City Lab from UCLA, looking at how do you take these tiny little lots that are just a few thousand square feet, not big enough to put on multifamily, and how do you make it beautiful? How do you make it functional? How do you make it denser? These are the things we're looking at. And every city or county owns many, if hundreds, if not dozens, of these tiny lots. So what can we do to bring in more infill development? But so many other things need to be in place first before we can make that work. So that's what we're working on together. And also we look at any kind of housing, manufacturing, innovation. We've had a few factories come present to us once in a while. I have another one that I would like to present that's building smaller homes. They're called Clever Homes. Oh, there is, by the way, this weekend on Saturday, the 18th in Orange County at the fairgrounds, a tiny home festival. So if you're interested, please look at that. And then tiny homes are not the little sheds that you see in the tiny home villages that are a work shed, a 10 by 12 work shed. No, these are actually modular homes. Um, and they're quite nice, surprisingly quite nice. So I'll be attending that. I'll report back, but just FYI, if you're interested in that. But anyway, this is what we do. We just explore what kind of options and solutions we have in our region. All right, Melanie, I'll let you talk about our mixer
Yeah.
and the tour.
Yeah. Thanks, Ayako. We have our fifth time we're doing this, affordable housing mixer. We're going to the Civil Rights Institute. We'll be back there. It is going to be from 4 to 6 on a Friday. We're trying a new time, something that kind of can help people kind of end their day and transition and be a little less interruptive to the middle of the day. And it's also going to be piggybacking a faith-based affordable housing tour that we are doing for some of our faith leaders and local electeds in the area. Um, the mixer will just focus on, we're actually going to do a little bit of data validation in that mixer, provide a little bit of policy update. Um, and so, as Ayako said, the agenda is pretty light. It's meant to be collaborative, resourceful, and just an opportunity for folks to meet. I think historically we usually have like 2 to 3 partnerships or deals that kind of come out of these annual things where folks from across the region are able to meet or to get connected with someone that they've been looking to be connected with. And so if you have time and you want to come over at 4, we'll be starting at 4. And I will be joining at 4 with probably a few folks from a few pastors maybe and a few other electeds who will be finishing the faith-based affordable housing tour that we'll be doing in the region. I actually do have a few slots left, so if there's something that if anyone here is very passionate about spending the day on a bus with us, learning about this and visiting some local sites, let me know. I have just a few seats open that I could offer to anyone here. So just to shoot me an email right after this, and I could get you registered for that. And so we're excited to report out about that experience and those findings from the tour, and then to bring some of those folks over to the mixer to carry on those conversations. So we hope you all can join and pop over and say hi to each other and see each other in person, because we don't get to do that very often. And so next we can go over to, I put the link in the chat.
Melanie,
Mhm.
before we move on, if I may interrupt, since we have a few people on the call, our in-person, networking event is hard to schedule because our region is so vast, right? If you live in Needles, you're not going to drive out to Riverside to go to a networking event, and we understand that. Neither would we probably. So, uh,
Mhm.
but uh, but there is value in meeting in person. If downtown Riverside, that part of Western Riverside area, kind of southwestern San Bernardino County, if that region doesn't work for you, if but you really would like to know, please let us know. We are trying to gather this input of where can we get the most bang for our buck. And again, it is a challenge in our region. But if someone would like to say, or maybe even in the chat, if we did have an in-person mixer, you would go and you believe others would go if it were in a different region other than downtown Riverside. So we'd love to hear from you. We do want to make this more accessible to everyone. Thank you.
Yeah, Jay, if you want to pop in and provide an update for our wealth building and bank on.
Yeah, thank you, Melanie. Um, we did have an exciting event just a few days ago. with our annual Bank On Forum and brought a number of people together. And we focused on children and youth because there's a lot happening, especially this year. The state of California has, along with quite a few other states, implemented a financial literacy component for high school graduation requirements. And so, starting with the freshman class this coming fall, September 2026, that class will be the first ones to graduate in 4 years with the requirement of having a financial literacy course as part of their work. And the state has invited many partner organizations to participate in this process, not to take over and run the entire process, but to be a significant contributor to the process. And so we had a lot of good presentations. There are both state and federal child savings accounts now focused on a variety of different types of things. And so we had a number of presentations on that from both the state and federal government. And we were excited to have those individuals participating with us as well. And one of the areas that we are focused on is also helping young people become aware of things like their credit score, um, things like their ability to save and plan for their future, because we see so many of our prominent financial advisors in social media and the broadcast media helping people simply get back to zero and get out of the debt from credit cards, from uh, car loans, from predatory lenders. All of those things can sink people far below zero. And so we don't want our next generation to have that experience. They already are at zero, and we want them to be able to take off and be able to rise above zero, far above zero, into a place of financial wellness and health so that they can uh, provide for themselves and for future generations and do much better than our current generations have done. So we'll be having our next meeting on Zoom on May 12th. And at that time, uh, we will have Lisa join us and begin to help us focus on some of the findings and some of the future prospects for our wealth building pillar, as well as for our Bank On coalition. So exciting things going on. And we look forward to having many more partners join us in the work that is really important to our region. We've identified about 1 million people here who need safe, affordable accounts as BankOn is offering. And uh, one person, 10 people, 100 people is not enough to reach 1 million people. And so we're going to need many, many partners to move forward this work.
Thanks, Jay. We appreciate it and are
Yeah,
excited
thank you.
to hear all the especially the youth and next gen as we kind of dive a little bit more into that over the course of the next couple months and maybe even rest of the year. Excited to see what unfolds and what opportunities that holds for just not only our youth, but our families looking to just develop homeownership opportunities because we often see that correlation, but also just to stabilize families as many as we understand are on the brink of losing their housing or living paycheck to paycheck. So really just bridging that cost of living and addressing um, and really implementing those strategies, long-term strategies and short-term strategies for housing here. So um,
Yeah. Yeah.
I am just going to now, I just posted or I just put in the chat some of the details for registering for the Vital Conditions Network quarterly convening. I know there's some questions as the day that was feeding through the chat. I just put it in there and where you can RSVP. You could also just reach out to me and I'll forward you the newsletter announcement also. Um, but because there's so much happening, I wanted to ensure we had enough time for partners to share out what's happening in the region this month and even transcending into next month. So if you have an announcement or an opportunity that you want to elevate or um, a project or collaboration opportunity, let us know. Go ahead and just come off mute or raise your hand and we could share out what's going on across the region. Yeah, Robert.
Oh. Hello, everyone. Robert Carrillo here, founder and president of Launchpad Collective. I'm happy to update that our Launchpad on Baseline project in San Bernardino, mixed income, mixed use, has been entitled for 48 units over commercial space using AB 2011 bonus density law and the transit-oriented development district overlay. That was done last week. So we are now headed towards our pre-construction, or headed towards construction. We have our GC, we have our modular construction company as well. We have our architect all lined up. We are aiming for a July groundbreaking.
That's great to hear. Congratulations. I remember, I think it was in October or September in the fall when you guys came and presented about that. And, I know you guys were halfway there at that point. So congratulations on that. That's a huge accomplishment and
Thank you.
just, yeah, a great spotlight for our region too. So great work. Anyone else? Yeah, Aisha.
Hi, I just wanted to introduce myself for folks that haven't had the chance to meet me. My name is Aisha Mansour. I'm with Southern California Association of Nonprofit Housing. I'm going to go ahead and drop a PDF in the chat. This is just something called our menu of services. If anyone's ever looking to do a collaborative event with SCAMF, that's something that we offer. I know one of the things we offer for cities is an affordable housing 101, especially with new elected officials and new folks coming into the city. If you guys aren't familiar with what affordable housing is, we offer a lot of resources and a lot of even in-person sort of workshops just to sort of educate folks. So just wanted to kind of uplift that and kind of bring up an opportunity for that regional kind of collaboration that was mentioned in the strategic planning. But just wanted to drop that menu of services in there and let you guys know the things that SCAMF offers. Thanks.
Thank you, Aisha. In the chat, I'm dropping in just real quick. The date that is in here is past, but um, the state budget went to the sub 5 committee hearing on Monday, and they had asked for anyone, so they're still collecting sign-ons and stuff. So the date has passed, but they're still looking. So if any of your organizations wants to sign on to the state budget, this is with the statewide coordinated housing and homeless budget letter. And so they're reaching out to all housing partners, and I just wanted to make sure to elevate it, and I couldn't fit it into a newsletter before the deadline, but I want to put it here in case you guys want to follow along or to sign on for the state budget. So, Carson?
Yes, and thank you for that. Just real quick update here, NPHS, where you have a new headquarters up in Riverside, or Center of Community Enterprises. So that we are planning a kind of not a grand opening, but a open house for everybody in the community. If you're in the area, let me know and I'll put you on the invite list. But yeah, we're going to do a little open house in Riverside at a new spot. So just let me know if you're interested and I'll be sure to invite you. But invites will start going out in the next few weeks.
Do you have a date, Carson?
Yes, it is May 14th, so Thursday from 4 to 6.
Awesome. Is Veronica still on here? Let me see. Oh, there you are. Yeah. You want to come off mute and share about the on Tuesday? What's happening Tuesday?
Yes, happy to share. So on Tuesday, the 21st, from noon to 1, ICLS is hosting, we call it Tea with Tessie. We've done it on different topics, but this month being Fair Housing Month, we're going to be sharing out some more information about our current housing work, including some of the cases that we've been working on in both San Bernardino and Riverside counties. And if you are interested in joining and attending, please email me. I put my email address in the chat and I'll add it here again. It's 1 hour and again, just kind of a panel to update everyone on the work that we're doing as one of the largest legal aid organization in our region. And Jay Miller will also be joining us as one of the panelists.
Awesome. Well, if there isn't any other updates, I'm just looking to see if anyone's coming off mute or raising a hand. But if there is any other updates, I just appreciate you all coming and being here today and just sharing and interacting in our strategic planning validation time too. You will see that again woven out through next month and some of our pillar meetings too. But we just appreciate that and all your feedback helps inform the strategies for the collective and also how that the collective can support all the great work that you guys are doing and how it can be most effective. So we get to give some time back today, so I appreciate you guys all hanging out and I look forward to seeing you guys, hopefully most of you guys this Friday. So take care.